Hey everyone, it is Friday. It's time for our compilation video. I know I'm posting things a little bit later than I normally do, but it's been a little bit of a crazy day. I'm here on call this weekend, so I'm in the delightful call room, as you can see, and we're going to be talking about arousal disorders. Now, our languages that we did this week, that I kind of probably butchered, were Cherokee, Mongolian, and Javanese. So if this is something that you like doing, let me know below. I know it's kind of silly, and I'm really just doing it for me because I'm like a linguophile, but if you like it too, then that would be great to know. So we've been talking about arousal disorders, looking at kind of what goes into that, physiology of arousal, different types of therapies for arousal problems, as well as different conditions that either affect arousal or are affected by issues with arousal. So from a purely physiologic standpoint, remember that sexual arousal is the physical response or physiologic response to desire. And remember, desire is that want to basically have an intimate experience with someone or something. So from a physiologic standpoint, we're looking at things from a couple of different places. Not only is there the kind of mental aspect of being turned on, but there is also the physical response. Now, hormonally speaking, this is due to a large number of excitatory hormones that are released. There's also a lot of sex hormones, specifically testosterone, that are involved with this too. And then we also have what's called the parasympathetic nervous system at play. And the parasympathetic nervous system is the portion of our nervous system that we really have no control over. Or the autonomic nervous system is that portion. Parasympathetic is a portion of the autonomic nervous system that basically regulates like rest and digestion and all those kind of chilled out things. But it is necessary to have that parasympathetic innervation to cause arousal, because from an evolutionary standpoint, if you're being chased by a bear, the last thing you want to do is to try and procreate with someone at that time. And so it's a defensive mechanism. When we're anxious, when we're worried, blood gets shunted away from our genitalia. Therefore, it's very difficult to become aroused. So what happens then in an arousal situation is you have an inflow of blood to more superficial vessels. That's why typically people get kind of flushed when they get aroused. Our pupils will dilate. We see something that we like. You may notice that your breathing increases, heart rate increases, blood kind of goes away from the stomach. And so you have actually like kind of that kind of weird tingly feeling sometimes in your belly, and it pools more in the genitalia, especially in areas in the genitals that have sinuses or kind of like caverns where that blood can fill. With the penis and with the clitoris, there are a couple of very significant sinuses there, both the bulbar cavernosum and kind of in a way the bulbospongiosum. But these basically are what fill with blood to allow erectile tissue to be kind of detected in those specific organs. Now, obviously, from an autonomic standpoint, you're also triggering a lot of the parasympathetic receptors in the whole pelvis. And what that does for the vagina is increase secretion. It increases lubrication to aid in sexual activity. And actually, the cervix and uterus kind of dip down lower into the vagina as well. Cervix will actually kind of dilate a little bit too, which is kind of an interesting thing. So it's really kind of a whole system response to this sensation of arousal. And so obviously, if something is interfering, therefore, with that neurovascular or hormonal response, you're going to have arousal issues. So the kind of paradigm arousal disorder, especially in people who have penises, is erectile dysfunction, right? This is the one that's probably the most publicized. You can look on TV or whatever, and do you have ED, and whatever it may be. And so what's going on there is that you're having an interruption in that blood flow to the penis, and so the penis has a harder time becoming erect. Well, the clitoris is much the same. It's a homologue of that structure, just kind of in smaller size as a general rule. And so, if you have a problem with blood flow to the clitoral area, well, you won't get that same type of clitoral erection. So what can cause those things, you may ask? Well, the first thing, kind of in a total body type thing, would be something like anxiety or concern about what's going on sexually. Now, this can be either more of like a performance anxiety, this can be a, oh my gosh, are we going to get caught type anxiety, or this can be a, is this going to hurt? I don't know if I really want to do this, whatever it may be type of anxiety. It's all the same, really from your body's standpoint. But what's happening is that instead of having that nice parasympathetic, chilled, relaxed, kind of cool, man, let's get jiggy with it type, innervation, you're actually getting more of a sympathetic innervation. The sympathetic nervous system is kind of our fight or flight response. So what does it do? Well, basically reverses everything the parasympathetic does. So it shunts blood away from the genitalia to our heart, to our lungs, to our brain, to our skeletal muscles, basically so you can run away from said bear or from the barbarians chasing you or whatever. So obviously, if you're having that anxiety response, blood is going to go away from the genitalia. And so it can make it very difficult from a physical standpoint to become aroused. That leads to vaginal dryness. Vaginal dryness can lead to pain. Pain can lead to worry. Worry can lead to not wanting to have sex. It sounds like kind of something from Star Wars, with the Force. Now, that is obviously an emotional side of things. Now, there can be other types of issues with arousal too. Some people may have a physical response to arousal, but they just don't feel turned on in their brain. And usually that's more of a response to previous traumas or sometimes even head injuries. The limbic system is the portion of our brain that regulates kind of pleasure and that kind of sensation. So if you have had some sort of head trauma, whether that's from an accident, brain tumor, something like that, whatever it may be, that can potentially lead to these type of things. And this really comes into play with some of the orgasmic disorders that we'll talk about sometime in the future. The other thing that we can see, especially from a brain standpoint, is different types of hormonal issues. Now, remember when we were talking about DHEA last week, we were talking about things coming out of the pituitary. Well, if that pituitary is injured, it can cause inappropriate responses to our sex hormones as well, which can lead then downstream to arousal issues. So outside of the brain, probably the most common thing we're going to see is either a vascular disease, such as high blood pressure, or even something like diabetes, which at its heart, remember, is a microvascular disease. It causes problems in little tiny blood vessels, such as you would find in your genitalia. So you can actually have areas of numbness or tingling, or even neuropathy, nerve pain in the genital structures, which can lead to problems with arousal. Obviously, people that have had any type of spinal cord injury, especially in their sacrum, if they have any type of pudendal neuropathy, may manifest with problems with arousal too. So there's a lot of things there that can go on. So how do we treat this? Well, you got to figure out, just like with anything else with sexual medicine, where the main issue is. Is it in the brain? Is it more a kind of as an end organ type thing? If it's related to anxiety about sexual activity, the thing to do is to kind of address that and really try and figure out, okay, well, why are you having this anxious response? Is it something more related to like a performance anxiety? Is there worry about pain? Kind of what is it? And basically, depending on what it is, lets you know kind of where to go. So if you find that it's more of a performance anxiety, doing some type of counseling techniques that can help with that can be really beneficial. If it's something a concern about pain, trying to remove that painful stimuli, once again, can often kind of help with those arousal issues. Now, if it's something related to more of a vascular type standpoint, well, we start to turn to our old friend that we've used for erectile dysfunction now for many, many years, the medication called sildenafil or Viagra. This is a phosphodiesterase inhibitor. This class of medication basically goes in and causes blood vessels, kind of in this case in the genitalia, to dilate. And so that it allows more blood to flow to that area. So you can have that sensation of physical arousal in your genitalia as well. I get a lot of people saying, well, okay, Viagra, that's a drug for men. Well, no, it's not. Like, remember, drugs don't care. Drugs are not for men or for women or for camels or whatever it may be. They're just drugs. They don't have a care in the world about who they're actually treating. Kind of same with hormones. Hormones don't care, what gender, you are. And so you can use Viagra, even if you are a person that has a vulva and a clitoris and not someone who has a penis, you still get the same type of response from it. But if you're worried about systemic effects, well, you can compound it into a topical cream. And a lot of compounding pharmacies will sell these with some, term like scream cream or dream cream or some kind of, whatever rhyming scheme for that to try and help kind of blood flow go to the area. And typically they'll combine it with something like L-arginine or some other type of vasodilators too. There are also different types of devices you can use, anything from kind of vibrators. They used to have a device called a Fiera, which created like a little suction cup to the clitoris. TENS units can be helpful. And then for patients that have, vaginal dryness, especially as a result of some of their arousal concerns, well, any type of lubrication or, even using like a vaginal moisturizer, in between sexual activities can be really helpful too. Vaginal lubricants that are really good, you want to look on the packaging and make sure that the pH is appropriate, kind of the chemical composition, and then also the osmolality is good. And osmolality is how much water, basically, how it moves through the tissue. You want something that keeps the water in the tissue itself, not that pulls it out of it. So if you want to kind of my recommendations, you can send me a message and I'll give you those. But a lot of really great treatments for arousal dysfunction. Obviously, pelvic floor physical therapy, if you have spasm muscles, can help kind of bring blood flow to the genitalia as well. And so this is a wonderful thing that can be done as well to help. Now, specific conditions that really kind of play into arousal dysfunctions, the main one I want to talk about outside of or that causes the most issues, if you will, is persistent genital arousal disorder or genitopelvic dysesthesia, so PGAD or GPD. This is a condition basically where you have unwanted, painful, bothersome sensations of arousal or abnormal genital sensations outside of sexual activity. Excuse me. And this can be something as simple as, a little itch or an irritation. It can be something as strong as feeling like, a hammer is hitting your genitals every, few seconds. Everyone's different. And with PGAD, it is very, very, very important to figure out, where the main issue is. And there's actually a whole way of following that so you can kind of, track, is it more in the end organ? Is it pelvic floor? Is it sacrum? Is it, spinal cord? Is it brain? Kind of where is it? And the treatments that you would do would be based off of where that is. Obviously, there's a lot about PGAD to talk about. I'm probably talking about it in its own thing here because it's a very, very important and often overlooked or underdiagnosed condition. So it's something that we really need to address. Other conditions that affect arousal, like I mentioned, diabetes, high blood pressure, anything that may cause problems with hormonal stimulation to the genitalia. Something else that we don't see or that, a lot of people don't think about are some of the connective tissue disorders. Ehlers-Danlos syndrome, May-Thurner syndrome, things along those lines can really cause issues. EDS or Ehlers-Danlos, basically in the connective tissue subtypes, can cause kind of ligamental changes in the support structures of the pelvis, which can lead to abnormal vascularity, which can lead to sometimes arteriovenous malformations or irregular nerve connections or innervations, and that can lead to problems down the line too. So, there's a lot of stuff to talk about here and to break down, and I know we're just kind of scratching the surface, but, arousal disorders, it's the thing that really bothers me, I think, the most about them is that so many times arousal and desire are lumped into one thing. And even if you look at kind of the latest edition of the DSM, which is the Diagnostic and Statistics Manual, kind of the big psychiatry textbook, they have this thing called female sexual interest and arousal disorder. It's one big thing. And that I do not like that. And this is my opinion, because arousal and sexual interest or sexual desire are completely separate, folks. They're not anywhere close to the same. That's like saying, well, hypertension and heart failure are the same thing. Yes, they both deal with the heart. Hypertension actually is more from the kidneys, but that's neither here nor there. But it's not the same thing. Sexual desire is up here. Sexual arousal is up here and everywhere else, but they're different mechanisms. So anyway, that's my soapbox for that. So anyway, that's what I'm talking about today. Obviously, if you have any questions, please let me know. Next week, we'll be doing things on Tuesday, Wednesday, Thursday, kind of a shortened week because I'm going on vacation the week after that, so I won't be posting anything then. And then I'll hopefully have very, very, very big news to share with you after that. So obviously, if you have any issues, give me a call, send me a message, send me a carrier pigeon, whatever it may be. If you've watched me this far, please like this video. If you like it, share it with your friends. I'm Corey Babb, and I will talk with you soon. Have a great weekend.